अस्सलाम वालेकुम। सो आज जो हम टॉपिक डिस्कस करने वाले हैं उसका नाम है एम्बोलिज़म। सो एम्बोलिज़म जो है ओक्लूजन ऑफ द ब्लड वेसल्स होता है बिकॉज ऑफ सम ओक्लूजन ऑफ द ब्लड वेसल्स होती है बिकॉज ऑफ एम्बोलस which is either in the form of solid, liquid or gas, which is mainly formed somewhere else in the body, but it's going to be transported through the blood to the distal part of the body where it's going to be occluded. So this is called the embolism, and embolism is the formation of that embolus का ना. और embolus जो होता है it is actually that clot of solid, liquid or gas. ठीक है. पर इसके बाद if we talk about the most common embolism is like thromboembolism, because the thrombus dislodges and it's going to be glued in different part of the blood vessels in the body, and which is ultimately causing thromboembolism. Okay, if we talk about the types, there is going to be pulmonary thromboembolism, systemic, air, fat, and amniotic fluid embolism. Now first we are going to do the thromboembolism, the pulmonary one. So this is if you talk about the pulmonary, so there's going to be occlusion of the pulmonary vessels because of this. Like if you talk about what is thrombus, the thrombus is going to be dislodged and it's going to be occluded in the pulmonary vessels. Okay? And the most common thrombus is like deep venous thrombosis, and it's going to be going into the systemic circulation, like the blood vessels, and then after that there's going to be going into the right side of the heart, and after that it's going to be going to the pulmonary vessels. If we talk about the clinical and pathological features का ना, तो short vessels जो होती है ना, तो उसमें जो occlusion होती है ना, तो वो बहुत silent features होते हैं, उनके silent symptoms इतने prominent नहीं होते. और जो large blood vessels होती है ना, उसमें अगर हो जाए तो उसकी वजह से बंदा डेथ हो सकती है. और medium size blood vessels में occlusion होगी ना, embolism होगा ना, तो that's going to be like very, what do you say that it is going to be very it's going because the medium sized blood vessel is going to be having the collateral supply, so there's not going to be any consequences. Okay. Now the mainly the pulmonary thromboembolism is mainly in the distal vessels, like the end arteries, and it is going to cause the sided heart failure, as well as the pulmonary hypertension. Now we're going to do the systemic thromboembolism. Systemic one is having the thrombus dislodges from the large blood vessels, like the mitral thrombus, or the large aortic thrombus, and it's going to be dislodged and it's going to be occluded in different part of the blood vessels in the body. The most common sites are the lower extremities, the brain, intestine, kidney, and spleen. And now if we talk about the the consequences, so the consequences of embolization depending upon the like इसको हाथ ये उंगली है ना, तो we're going to check the caliber of the blood vessels, we're going to check the collateral supplies, we're going to check either the type, like adaptability of that blood vessels, like how much it can survive without the blood or oxygen, and we will check like if it's mainly embolism happens in the end arteries, like lower extremities or extremities. So we'll check. These are the things that are important in embolization. For the consequences of embolization, now we're gonna, this is a thing called the paradoxical embolism na. So paradoxical embolism is a type of embolism which is the venous embolism, but it's going to be transferred into the left side of the heart na. तो राइट साइड ऑफ द हार्ट से ना लेफ्ट साइड ऑफ द हार्ट में जो एम्बोलिस आ जाता है ना, तो उसको हम कहते हैं पैराडॉक्सिकल एम्बोलिज्म. और ये हमारे पास जो एट्रियल या वेंट्रिकुलर सेप्टम है ना, उसकी डिफेक्ट की वजह से होता है. ठीक है, एट्रियल या वेंट्रिकुलर डिफेक्ट की वजह से होता है. नाउ फैट एम्बोलिज्म पे आ जाए ना, तो फैट मतलब फैट ओक्लूजन होती है डिफरेंट, लाइक डिफरेंट, या तो कोई हमारे पास कोई इंजरी हो गई हो, ठीक है, या कोई फॉल वगैरह हो गया हो, या तो कोई बंदा फैट इनटेक बहुत ज़्यादा बंदे का, बोन मैरो इंजरीज वगैरह हो गई हो, लॉन बोन इनकी इंजरीज हो गई हो, ठीक है, तो उसकी वजह से हमारे पास फैट एम्बोलिज्म होता है, ठीक है। और फैट एम्बोलिज्म में मेनली अनीमिया, थ्रोम्बोसाइटोपिनिया और पेटिकल रैशेस वगैरह होते हैं, ठीक है। आता है एमनियोटिक फ्लूइड एम्बोलिज्म ना, तो एमनियोटिक फ्लूइड एम्बोलिज्म इज द मोस्ट कॉमन एम्बोलिज्म like the in the which is going to cause the death of the mother because of the umbilical blood vessels. The embolism is going to be transported from the fetus, or what you say, from the fetus to the mother, and there it's going to cause two things, because the amniotic fluid is contained mainly two things which is going to cause the embolism. The first, we're gonna have prostaglandin, which is going to cause the pulmonary constriction, and second, it's going to be having the thrombogenic factors, which is going to cause coagulation. Okay, that's it. Now we have air embolism. Air embolism, this obviously there's occlusion of the blood vessels because of the air. Air mainly come from like different stunt, if we put some kind of stunt, or because of certain injections, or because of certain surgeries, thoracic surgeries, or neurosurgeries. And nitrogen embolism is also very common. And what is saddle embolism? It's like the bifurcation of the pulmonary arteries. There's going to be embolism. That's called the saddle embolism. That's it. Thank you.